Good evening. It's 8 o'clock and welcome to today's episode of Marvelous Medicine. The topic is gender bias in medicine. At the outset, I'd like to clarify that today we'll be only considering male and female gender, and since there isn't enough time to cover the whole spectrum as we were mentioning earlier, so we'll come to the rainbow some other day. When a couple of weeks ago we had the session on sexual harassment at the workplace, when I shared the poster and the link, many men and women got in touch with me one-on-one. But some of the predominant responses for women were about gender bias in at the workplace more than sexual harassment. So I didn't want to dilute an important problem like sexual harassment by mixing it with the gender bias. So I promised them that we'll do a separate session. And since Kalavathy was one of the first to respond, I put the onus on her to plan and execute a session, a panel discussion on gender bias in medicine. Dr. S. Kalavathy is a senior consultant, critical care at SIMS Hospital, Chennai. She did her MBBS from KMC and DA and DNB anesthesia from Madras Medical College. Subsequently, she did her diploma in critical care medicine at Apollo Hospitals, Chennai. She's also a trained copy editor and proofreader and copy edits medical articles for international journals. She's also a freelance consultant for implementing quality system and a marital counselor. Welcome, Kalavathy, and thank you for taking the lead for today's session. Joining as a panelist will be Dr. Pratima Ramachandran. She's a coordinator and senior consultant, critical care services, Apollo, specialty hospitals in Chennai, and also an adjunct associate professor at AHERF. Pratima did her MBBS from Vinayaka Mission Medical College, Salem, and DNB anesthesia, IDCCM, and IFCCM from Apollo Hospitals, Chennai. She is also qualified for the European Diploma in Intensive Care and was awarded the Honorary Fellowship of the Society of Neurocritical Care this year. Pratima's areas of interest include neurocritical care, critical care nephrology, and simulation. Simulation is what brought me in contact with Pratima. I attended a faculty development program for training in simulation at Apollo Hospitals, where Pratima was faculty. And on the drive back, we got chatting, and somehow everywhere nowadays my entire focus is on finding topics and speakers for Marvelous Medicine. So when this topic came up, I immediately thought about Pratima. Thank you, Pratima, for logging in despite the internet and electricity issues. The other panelist is Dr. B. Harapriya. She's a consultant pediatric cardiology at MIOT Hospitals, Chennai, and founder trustee of an NGO called Mending Tiny Hearts. She did her MBBS from JIPMA Pondicherry and DNB Pediatrics from Child's Trust Hospital, Chennai. She's trained in fetal echocardiography, a cardiac MRI, and has experience in cardiac CT and pediatric intensive care. She has created a mobile app called Smiling Heart to facilitate early detection of critical congenital heart disease and is an advisory board member of Shastra TBI, which does research in bioinnovation. Harapia was again one of the people who reached out to me about gender bias when we were talking about sexual harassment at workplace. And she shared this interesting article, Tawa to Tavi, which is written by a female cardiologist when she was congratulated for doing her first Tavi by saying that, hey, good, you have moved from Tawa to Tavi or some such thing. So that has been the inspiration for today's session, and we hope that the writers of that paper will also be logging in to today's meeting. I have to specially thank Dr. Murli Krishna, who agreed to be a panelist. He's kind of overwhelmed with 4 or 5 women, but he's going to stand his ground, and we wanted to hear the male perspective. Murli Krishna is the lead consultant and head at Kaveri Hospitals and managing director of Scans World in Chennai. He's a radiologist. He did his MBBS from PSG Medical College, Coimbatore, and MD in radio diagnosis from Mahatma Gandhi Medical College, Pondicherry. He is currently the Secretary General of the Indian Radiology and Imaging Association. Murli has received the Asian Oceanic Congress of Radiology Young Achiever Award and Dr. Ashok Mukherjee Award of IRIA. He has presented in several international and national conferences and has several publications and book chapters to his credit. His special interest is oncoimaging. Last but not the least, we have Dr. Kadambari, who's the professor of surgery, Department of Surgery, JIPMER, Pondicherry. Kadambari did her MBBS and MS surgery from JIPMER and is a FEMA Masters in Health Profession Education. She also received a UICC Technical Fellowship in Oncoplastic Breast Surgery in UK. She is a member of the core group faculty of the National Teachers Training Center at JIPMER, Pondicherry. She has 51 publications, 3 book chapters, and has authored a book on medical education. Thank you, Kadambari. When I reached out to Kadambari, she's actually writing a paper on gender bias and having supposedly broken the glass ceiling, or being from a different generation from women who are struggling to make their place in medicine today. I thought we should have the perspective of somebody senior about this problem. So thank you so much, Professor Nandi, for joining the meeting, and we'd like to hear your opening comments before Kalavathy takes over.
Opening comments. I unfortunately, I've lost the wretched thing. Carry on.
Okay. Okay, Kalavathy, whenever you're ready, sir, you can just raise your hand or indicate to us.
Yes,
Over
sir.
to you, Kalavathy.
The network is gone.
Yes, madam.
No, sir, we can see you and hear you, sir. Yeah.
So thank you for the nice introduction, madam. And even as we get to start the session, I'm very glad to see...
One short interruption, Kalavathy. Murli, can you please turn your camera on and also name yourself so that the audience can recognize you? Or maybe Radhakrishna can do it for you. Radhakrishna, can you make him Murli Krishna?
Yeah.
Yeah.
Just Christian name. Sir, Nandi sir, your audio video is all right. If you want to say something to start with, your net is all right.
I think he's probably the speaker is not working. So carry on, Kalavathy. Let him figure it out. Yeah.
I'm audible, isn't it, madam?
Yes, clear.
Okay, good. So I'm very glad to see that a fair share of male presence in this so far, whoever has been logging in. And to get it all started, the very topic tells it all, though it brings to mind a biased orientation about the topic itself. It means automatically it brings to mind a particular line of thinking. So anyway, to give a brief introduction to it, bias is prevalent in all of us, and all of us do have biases in various forms, because we have a tendency, our brains have a tendency to automatically categorize things that we encounter so that we can make sense of the complexity around. So only then our mind is able to also process it. But the flip side is biases can lead to prejudices against others, and these can lead to inequalities where the problems come between different demographics. So here in this forum, this evening, we are going to see gender bias and its many forms. We will be dissecting it to some extent, and in what all forms it can appear, and particularly at the workplace, and as the topic suggests, in the field of medicine. And to define it, gender bias is the tendency to give a preferential treatment to one gender over the other. It's an unconscious or an implicit bias, and where it attributes certain stereotypes to another person group. We see one particular gender and automatically it's a conglomerate of a particular characteristic or a conglomeration of various aspects which we attribute automatically, even unconsciously many times. And this can affect the manner in which we engage with the other person or the other people group. And when prejudice is solely based on gender, we might call it as gender discrimination. And when it is particularly an unfair treatment meted out based on that. And we will be also seeing about how it starts, though I may briefly say that it largely starts at home. and many good things arise from home. But unfortunately, many of our biases also arise from home. And the society also reinforces it in various forms, and how the society engages with us also. And many times it gets carried on into our adult lives, and how we deal and interact with people. And these become our worldview. So what starts at home, or what starts from childhood with our different engagement with in a very domestic way, finally grows into us, and then it also extends its way into the workplace. So before going on to talking issues on this, there are disclaimers. We are going to stick to gender binary, and then we will take audience's questions at the end after we gone through the various issues in this gender bias session. So to start with, I would like to Dr. Murli to speak on this. How does bias get originated in us? Where does it start, and how do we pick it up, and what reinforces it?
Good evening, ma'am. Good evening to all the panelists and to all the members of Join. So, I mean, gender bias in medicine, since we're talking about it, has a very long history, and it originated, during the time of the Greeks, where women were always subordinated to, and kept as subordinates in medicine, politics, education, or even in wealth. Even some great thinkers like Aristotle and Hippocrates did not consider women equal. In fact, Aristotle has said that woman is just the inverse of a man, and he in fact he drew the famous why based on that. But then modern scientific medicine has flourished in these exact conditions, with men dominating it over the years. Unfortunately, it has not, remained only to, the profession itself, but even to, the research and the secrets of, that the disease of men and women are different. And that is this famous called the Yentil syndrome. I don't know how many of you have heard about it. So in which, after a long thesis, it was proved that, heart diseases, the symptoms of men and women are completely different. But over the years, only the heart symptoms of the men were considered, and that has been the case with all projects or all researchers where there are more of participation of men, and that is when the origin of bias, not only in the field of medicine but also in the field of treatment of medicine. It all started. But then, we have come a long way. The Dr. Lovisa Alberg, the first doctor in 1830 in Sweden, to Dr. Elizabeth Backwell, the first doctor in the United States, to Anandi Ghosh from India, the first doctor at 1865, to Dr. Muthulakshmi Reddy at 1912 from Tamil Nadu. And, we are working to cover this bias, but then, taking it further, as you had already said, bias in India especially starts at home, and it includes the culture and tradition. And to give you some statistics, almost 50% of urban India, the women still stay at home. So, and we're not talking about even rural India. So that is how the bias. I think that is the origin of bias as far as medicine is concerned.
Thank you, Dr. Murli. Sir, Dr. Nandi, sir, we would like to have your inputs on this. Origin of our biases on an individual basis.
I must say that when I'm on a selection committee and there is a man and a woman who are equally good, I always choose the woman. But I think that this is wrong, because this is, this is unfair on the man. But my long experience with residents is that the women generally are more careful and they work harder. And this has been not established, but suggested by a big Canadian study where they looked at the same operation done by a man and a woman. And although the woman took longer, the results were better. But there's some negative points. The negative points are that women, when they join GI surgery, become pregnant, and therefore they lose kind of 1 year out of the in continuity. The second is that when they have children at home, the child wants the mother there and they don't want the father. So they suddenly ring up and say that my child is sick and I can't come. And I think all these things, the genetic problems and should be debated somehow. And what is interesting is that world over nowadays, about 50% of medical students are women, but very few professors or very few top flight surgeons are women. And I think these things should be investigated. And I think it's not a simple problem. It's not, I am the father of a very strong lawyer who's a feminist. And my wife, my late wife, was a very strong feminist, as was my mother. But I still think that women are harmed by their gender because they have to get pregnant and they have to look after children. And when I always say that when you have to choose between your family and work, men choose work and women choose family. Overall generalization. And that's the end.
Thank you, sir. Now, again to Dr. Murli. How do you think the bias or the prejudice itself enters an individual? It doesn't come overnight. It grows over a period of time, isn't it? Even in our homes, sometimes, not universally though, but we do see. So how does it enter? How does it get reinforced, and how does it impact?
Murli, you need to unmute yourself, please.
I think the origin always is from at least for the Indian context, it is at home. And I said, even the case of joint families that is very common in India, whether it's a boon or bane, because just said that women have to take care of the family. So will joint families actually help? But research has said that joint families actually increases the mobility of men, but decreases the mobility of women. Because it actually becomes an additional responsibility for the women in joint families, and so their mobility actually decreases with joint families. I mean, to more than men, I think the mothers at home play a very, very significant role in generating this bias, and this problem is been imbibed in our culture, and it might take a few years, even between a son and a daughter, and there is a whole household work. I'm sure that all of you mothers would not definitely ask your son to do that household chore, and without a blink you will ask your daughter to do it. So I think that is extending to the workplaces as well. And as even as women at leading positions, to pull up a fellow women is something that we don't see quite often, and that I think is the origin of the bias, at least in the Indian context.
Thank you, Dr. Murli. I'd like to address Dr. Harapriya to take this. Since it is in the field of medicine, we will limit to the work area and not to the college days. How do you think the recruitment processes and employment opportunities create a place for bias? Do you think there is any bias, or we would like to know your inputs?
Harapriya, you need to unmute yourself.
Unmute.
Yes. Yeah. Am I audible? Yeah. Okay. Thank you very much, all of you. Good evening to everyone. Thank you for having me here. So, as the question goes, I think with due respect, Professor Nandi has already told his view on how he would recruit anybody when he sees a man and a woman together. who are equally qualified. But I think everybody may not have such kind of a perspective. And I'm sure a lot of us who have gone through interviews, either when we are about to get, like we face questions like, are you married, or do you intend to get married very soon? The next question is, do you intend to get pregnant very soon? It's such kind of things which we have to answer as a part of an interview itself. I'm sure a lot of us have undergone that. So I've also seen my own friends and colleagues who have gone for interview, being in the second trimester or whatever. They have been refused the jobs, even though how much ever well qualified they are for that, because for the very reason that once they are recruited, they would immediately go on a maternity leave and whatever comes after that. So I'm sure this kind of recruitment bias is definitely there when it comes to women, at least when they have to go through marriage and pregnancy and childcare. But having said that, I'm sure we have come a long way where people are able to take decisions on when they want to get married, when they want to get pregnant, and they have a say to it, and they're able to decide between career. I know many of my colleagues who kind of postpone childbirth because they spend most of the time in the cath labs, and they take a year or two off cath lab. That's a sacrifice of career as well. They go a few steps backward, give up cath lab for 1 or 2 years when they embark on the pregnancy and until their child is older. So it's just a balance of everything, and I'm sure these days people are able to balance it out to a great extent, definitely.
So having said that, if like from the employer's perspective, if you're looking for a workforce and that workforce is going to be missing for some time, like how Dr. Samira Nandi was mentioning, how do you mitigate that?
I think that has to be accepted to a great extent. That is where the inclusivity comes the factor. If we are going to have women as a part of the workforce, as an equal contributor like any other man, then I'm sure these things are part and parcel of it. As long as we are able to accept it, and there are other people who pitch in during that time, and then once the person comes back after the break, we are still able to give them the due, then I think that's the only way we can, the way we all are able to support it only is the way we can mitigate it.
Yeah, thank you. Regarding resource allocation and non-inclusivity, what do you think about these?
Yeah, I think there was some discussion about this recently in some other forum as well. In fact, like I'm not from an academic institute, but Professor Kadambari and other people in academic institutes may be able to say better, like how they are faced with when they seek research grants or whatever. Apparently, there is a lot of literature, like from Western literature, that grants are preferably given to men rather than women. But again, when you look at the Indian scene, whether it is the Department of Science and Technology or women in research, there are many other groups which are like promoting a lot of women scientists into research. So in fact, maybe it was a bad scene earlier, but now there is a lot of propaganda for women there are special grants for women itself. I think that's a great step forward, and it's a good thing, definitely. So I am sure such kind of biases did occur earlier, but I think over the years, today maybe the scene is really different. At least, I mean, the fact that they had to specially give out grants for women itself is a testimony that that bias was really rampant earlier. But with these kind of special schemes and other things, I'm sure we are having a step forward.
Actually, it was very nice to see the ISRO team. A lot of women were there.
Exactly. In fact, when I was going through, there are a lot of research grants which are especially for women. In fact, starting from IIT itself has started some quota for girls. So it's like that.
And in the ISRO team, we can see that all of the men and women had contributed equally and greatly to the whole success. So that
absolutely
is to see. Yes. I would like to address this to Dr. Pratima. What do you think of performance evaluation at the workplace and performance reward for the work done in the context of gender bias?
Hi everyone. Good evening, and thanks for including me in this great forum. So yes, it had been very nice topic opening. Yeah, comments were good. So I can start this with a few questions. I know it's about a performance review. The thing is, I heard about the interview. Should we look a person who has come for an interview like a man or a woman? Should we even look at that? Or is it only the job which needs to be done? And should we really look at this is male, this is female? And there is when it starts, like how will she be able to like manage this, and even the performance review goes with that, same as the interview. Should we really have some check boxes or a checklist to just go about and tick, like this is essential for this work, this is essential for this work, this is not essential? Or should we just stop with the gender box, say that this is male and they have a separate checklist, and this is female, they have a separate checklist? So it is not, I feel that it is not the way it should be done. And there is difference when there is a female interviewing, sitting on the boss side and interviewing whoever is in charge, whoever is the HR, and a male conducting an interview. So definitely there is the mindset differs. There also is a gender bias. And based on the appraisal or things, I've been seeing, like somebody even mentioned pregnancy affects. Uh, so that is a very normal thing for a lady. Yes. And in this situation where we have a lot of infertility, I think healthy women, it is really very good for somebody to get pregnant. Being in a OMR IT corridor, what I see is all young men getting heart attacks. So should we look into that? And in that situation, the ladies at home are put into a crisis of taking care of the men at home, then going for work. So then they become like, they come out of their homemaking institution and they start working and start helping the family. So pregnancy is very normal, but and expected. But these type of health issues of male is now increasing. So we should we bring that also into a performance reviews, what we need to be. Yes, in IT there are a lot of other comorbidities suddenly coming up, a lot of health issues, but I see that more in the male and not in the female. So is it more of them not taking care of the health, or they are they not able to tolerate stress? So a lot of questions are coming up. I know I have to be answering this, but there's put in a lot of more questions into this. But as a whole, when I look into it, what I feel, when we do a performance review or evaluation, we need to have a checklist for the job description, other than looking as at an individual as a male or a female. I think if that mindset is different, we can really see whether that person fits for the job or not, than having the other things as what they could and what they will not be able to do.
Yeah. Thank you, Pratima. I would like to know what Dr. Samira Nandi thinks about this. Performance evaluation and performance reward. Is there any bias? For the same work done, do men and women get treated differently and get their compensations differently?
In performance, I think
Yes.
they do. I don't think there's any bias in performance. The problem is that there aren't enough women. You know, if you take part-time jobs, it's very difficult as a surgeon to rise to the top. And I know that a lot of people, countries in the world, are allowing women to do part-time jobs, to look after their children and their home. But I think that is one of the reasons why they don't rise to the top. Huge number of women nowadays are at a certain level, but the men tend to rise to the top because they're more focused on material success and medical success, while women, I think, look at it in a larger perspective and think that their family is very important and they shouldn't sacrifice everything just for the sake of work.
Regarding the performance reward, means the compensation?
The award, I think that it's interesting that I was reading somewhere that the number of papers published by men are much higher than the number of papers published by women. And so that you'll get, the chance of getting an award is much less for a woman. But if they're equally good, then I think that it's okay.
If I can just interrupt Pratima and other panelists, I think what Kalavathy is trying to say is, okay, there may be a bias in performance, but let's assume there was no bias in performance review, and both have checked the tick boxes. Are women given less monetary compensation or other types of rewards for doing the same work just as well? Does somebody want to take that question?
Yes.
Maybe in academia, Kadambari, and in government institutions,
Pratima,
the promotions are all time bound, and maybe there is less. But I want somebody to talk, somebody from the private sector to answer this question. Do you think that women doing the same job are rewarded less than the men? Isn't that the question, Kalavathy, you want addressed?
Yes, exactly.
So, ma'am, I have been in the private sector for quite long now, and I've been awarded appropriately. It is, as Sir said, the people don't come into even the award application because they are not feeling up to it, particularly females. And constantly, when they don't see examples of women coming up or rising up to the top, as it is mentioned. They do not have the motivation to do that because. When I say a doctor and nurse rounded today, so if most of you are almost all of you would have pictured doctor as a male and nurse as female. So that is how the thought process is. So if the doctor did well, and if the higher position is always ranked by a male, the award assessment might differ. And one side it is that, and other side is that the females, even the women, are not even applying for a academia award or something like that. So that is my opinion. I will leave it to the other panelists also and other people to just give their opinion.
May I just say that women are also responsible for this discrimination, because in my experience, my mother, for instance, I had two sisters, and everything was done for me because I was the only boy by my mother. And as far as I have one daughter and one son. My son got into a good university in America. My daughter got into Cambridge, but my wife said that she shouldn't go because we can't afford it, when she spent all the money for her son. So I think that it's not only the men who discriminate against women. Women discriminate against women because they have lower expectations of them.
Yeah. Anybody else also would like to answer this?
Maybe you can move on, Kalavathy. We can come back to the
yes, madam.
audience
Dr.
later.
Kadambari.
No, that's okay. We can move on. Yeah.
Yeah. This is to Dr. Kadambari. What do you think of this term, glass ceiling, madam? How real is it, and how does it impact?
Okay. So the glass ceiling is itself self-explanatory, isn't it? It is something that is apparently there, apparently not visible, but it is there. And so it's something that we are expected to break in order to overcome whatever problems we are facing. And sexism, as I would like to call it, and what you have called gender bias, if that is definitely something which is there lurking under the surface, and the term which has been used to describe it is a subtle form of everyday sexism. So it can be as innocuous as a remark which is passed by a male colleague, and then everybody just laughs it off and says, oh, can't you take a joke? But then it affects the woman who has to listen to it and just keep quiet because that's the way she has been brought up by society. And regarding the fact that the gender bias is propagated by the women, I think society is partly wholly responsible for that, because women have been taught to internalize the sexism that they face. And so women are scared for their daughters. I have a daughter, and I sometimes have the same feeling. I'm afraid for her, what kind of difficulties she will face. And so I always, we have been taught by our families and the societal expectations that we have always to be taking a step back and adjust, whether it's in the family or it's at the workplace. And so we carry this into our workplace, and we just take everything silently. So that is my viewpoint about this. And over time, I have had role models in my own family and in my workplace. Among my teachers, there have been women teachers who have uh, been excellent role models for me. And it is only after I have reached a certain level of maturity in the workplace that I have begun to even realize what is happening. And so I think, I mean, it's something that we should be doing for the younger women who come, who are entering into medicine now. And so it's something that women before me did for us, and what we need to do is for the next generation of women. So I think that that's where our responsibility lies.
Is it possible to break through the glass ceiling, madam?
Yeah, why not? Why not? See, the one of the ways that we resist this kind of sexist attitudes in the workplace is by looking to our inner strength. All of us have that inner strength, and I believe very strongly that women have a lot of inner strength, mainly because they put up with a lot of things throughout their life. In that way, it's an advantage because we face these kind of difficulties, and we learn to find ways to deal with them. So I definitely, that is one way in which we resist. And I was talking to you about some of my seniors. I have seen the way they, I have talked to them and seen the way they have dealt with these issues. So speaking up is one thing. If there is something that is going on and you feel that is unfair or unjust, I think we have to put our foot down and actually point it out to them. And maybe they are not simply, it just doesn't come within their purview, and they don't even feel that they are being sexist. So we have to point it out to them and say that no, this is just not acceptable, and there's a different way to look at things. And that is probably more what shall I say, effective in a sense, because when you want to educate somebody, it has to be by changing the way they understand things. And there are many men who are true feminists, who believe that who believe that women make a significant contribution in the workplace. And so so it has to be like a collective effort. We have to be not just women fighting for our own rights or our place in the workplace. It has to be men who have to be joining in as well. So we have to have some kind of an allyship where the entire organization changes its views and changes its policies in dealing with how women are treated in the workplace. And this point about the pregnancy, I myself have faced it. And it's called a motherhood penalty. And it's not just in India, it's all over. Everywhere in the world, women who are pregnant, who have had pregnancies or who have children are supposed to be less worthy, they are less capable, they're less committed. I mean, you can't blame them because they have to balance. And why is it always that the woman is the one who has to balance life and or home and career? So these are questions which women are asking now, and I think men should take cognizance of this and also look at it in an objective way and not just propagate that same image of men being the dominant sex and men being the strongest sex. Men are also capable of having nurturing, gentle, caring attitudes. And they, in fact, some of them are discriminated against because they're called effeminate or they're called sissy. But I think that is also a form of sexism. And so I think we have to change the way we look at things, and it'll take time, but we have to start somewhere.
Sanjay
Kalavathy,
Nagral has
Dr.
come.
Sanjay
And
Nagral is
yeah,
there. Welcome,
eminent,
Sanjay.
eminent
Yet another.
surgeon, philosopher, and writer.
Somebody calls spade a spade.
Thank
In
you. Thank
public.
you. But
Good to have you, sir.
apologies for gate crashing and
You're
please
most
carry
welcome.
on.
You were officially invited.
Oh, okay. I
Mhm.
didn't know
Yeah.
that.
See, but yeah, I gave you introduction before that you were coming.
Yeah, but I've just come.
Oh,
So I'm not
bias,
going to say
gender bias.
no.
Women discrimination.
I don't have to. I'm sure a lot has been said, but in case you insist that I say something, of course, I'm sure you've discussed the huge gender imbalance that we see in live donor transplantation, right? So I think you may have touched that area.
And not yet.
Not yet.
You haven't? Oh, okay. So,
Yeah.
that's yet another example.
So currently we are discussing the glass ceiling. In relation to that, what we see is that not many women are into executive level jobs or the higher echelons. So that is one observation. Is it because of glass ceiling, or is it because of underperformance, or what might be the reason?
Right. Well, so I frankly, I don't want to. I'm sure people have already spoken about it, but I can just say that, and there are quite a few here sitting next to me, and certainly in the surgical field, there is a huge stereotyping and huge bias over the years. Which is inbuilt in the way we talk, and I think the most important thing is that it's built into a sort of idea that, so you can ask any woman who's ventured into surgery, and they will tell you that they're often told that it's a tough job, and they have to do emergencies, and will they be able to handle it? How will they manage? So yeah, I think there's a lot of that kind of indirect stereotyping pressure still there.
Thank you, Dr. Sanjay.
Yes.
Kalavathy, you can move on.
Thank you. Thank you, sir. Yeah. Again, as Dr. Kadambari was telling, the whole load of taking care of children falls on women. But actually, increasingly, we see that these days men also are pitching in. When one of my friends saw this invite, she was telling, but then what do you think about maternal instinct? Since you had brought this up, I would like to ask this. What do you think of the maternal instinct that people say?
Are you asking me?
Yes, I am asking you,
Okay.
madam. Since
Yeah.
you mentioned that, why does the whole load of taking care of children fall on the women?
Yeah. What I meant was, yes, women naturally have, what shall I say, take to motherhood. What that is not what I'm challenging here. For example, in government service, we have something called childcare leave. And so a certain number of days in the year which are given to women to spend time with their children, etc. So it's not as if the childcare leave cannot be taken or should not be given to men to avail of. So because even with older children, for example, it's not always necessary that the mother should be there. So if it is like helping them with their studies or making sure that they're, most of the women who take the childcare leave with older children, they are going for their board exams, so they want to take them for tuition, this, that, and so on. So that is something which can also be shouldered partly by a male or the father. So this is just an example that I'm saying. So naturally, a woman takes to, and that is something which I also felt when I had a young child and I was working as a senior resident. There were days when I wouldn't see my toddler for, when I was on duty, post duty, and so on and so forth. There were days when I wouldn't even see her. But I had the support of a family, and women in my family used to look after her. So that is definitely there, maternal instinct or motherhood or whatever you call it. And that's a healthy thing. What I'm only saying is that this responsibility needs to be shared by the men whenever it is required, so that there's no, we were talking about breaks which happen in a woman's career because of motherhood and all those kind of things. So those breaks can be compensated or minimized in other ways. And if part of the responsibility is also given to the male. I think in some of the socialist countries, they have some kind of arrangement like that, where men are, in our Indian government system, I think paternal leave is given only for a few weeks, and that too within a certain number of months after the baby is born. So these are steps, probably small steps, which we can take. Yeah.
I saw a comment in the chat box that men also face glass ceiling. So in that context, I would like to address this to Dr. Murli. What do you think about reverse bias? When we call gender bias, you think in one particular direction. What about reverse bias?
So actually, there is a big article on this. I think you should, if you have time, should read. They call it "Are Men the New Weaker Sex?" So this reverse bias, I mean, we all are laughing at, but is very common now in Japan, most of Europe, and in America, where I think women have taken dominant and prominent roles, of course, because of their performance, and men are becoming the weaker sex. So the study has also further gone and said that it completely depends upon the socioeconomic development of those particular countries. And in medicine, if you would like to say, I think probably the bias is slowly starting off. And radiology is one such field where the bias has well crept in. So you might see that even if there is a job opportunity, there very specifically they mentioned that required women radiologists only. And I mean, we are at least in radiology, they are big in demand because. And even the salary parity is, if you are a female radiologist and a male radiologist with same experience, of course the women radiologists get paid more. And not that we are complaining, but the reverse bias has started, at least in radiology. And that's because, of course, now more female radiologists are also joining into the field. But yes, as a being a radiology association, I think the more we help women to take up leadership roles, this bias is going to keep increasing. But we should strike a balance at some point.
Yeah, thank you. So there is indeed a reverse bias also, which is a reality. Thank you, Dr. Murli. See, regarding the prejudice or this discrimination, sometimes it can be a fear of losing a privileged position or some advantage which gives. I would like Dr. Pratima to answer this. What could be the fears that can lead to biases? And are these significant, or are these unfounded, or are these real?
It is real, madam.
Fears that lead to these biases.
Yes, we can see there are a lot of fears. Actually, people don't really come out of the home violent to just fight with the other gender. They just work in a place, and they're somehow, as everybody who talked before me has mentioned, the society has definitely instilled a lot of fears in both the genders. So female genders, they think or they know that they expect themselves to be suppressed, and they get very defensive. I know females also are at fault when they think that they are suppressed and they will be suppressed, and they overreact and become very defensive. They get very upset because it is not only the workplace. They have a lot of issues they have fought through to come till that level. So they get very defensive and very upset even with small things. I really accept that. And on the male side, they sometimes think they should be looking good to the society, or it will be very wrong to them to not support females. Patronizing is one thing. I think we will be discussing more on that. The thing is, they think that they have to support women in some way. It is their duty to support them, and even without asking, they really need any support. They just overdo things and get into a problem. One is that, like, to look good, or they don't want to feel guilty about not supporting the weaker, so-called weaker gender. One is that. Second thing is, they also are not very comfortable competing with the other gender. So males competing with the female gender is quite, what to say, it is really something like an India-Pakistan match. There is a lot of other feel or mixed feelings in this competition. If two male or two women compete, it is a different level of competition. But males are not so comfortable competing with females. One is either they patronize and they feel that they shouldn't be overdoing, or they just have the fear of losing. And it is all the society. I don't blame men for that. It is all what they have been instilled in the society. So, or you be a man is what the very common term is. Man up. All these phrases and clauses have been in the society. So I don't know why it is always a man who should be up, and who should be always in the top ranks, and who shouldn't be losing. So a lot of clauses and phrases are there. Reverse bias is slowly coming up, but the very real thing that is called a reverse bias is also a bias. And fear is definitely there, and it is very significant. Sometimes it is very subtle till major problems come up. Particularly the fear of competition, working as a team, will the other gender, I don't want to mention whether it's a male gender or a female gender, irrespective of whatever it is, they have the competition when they have the fear of competition when they are working together. So will I be judged more? Sometimes when there is a same thing done by a man and a woman, they accomplish it equally. Women are given more appreciation because they feel that, oh, you also have done this, very nice. So that is what hurts the women. It is really not appreciation. It seems like they're what to say, they are like the people are very surprised to see a woman win, and a man is I'm not surprised at all, you could do that. So that is how the very common response is. So yes, there are fears which are leading to the bias, and in an outside people, in an outside teams, in an outside organization. So particularly the how they look and how they get what to say, personality, it has very deep roots. That's why the fear is real and it is still there. So I hope other panelists also agree. Yeah.
Pratima, I think the word you were looking for was patronizing, right?
Yes, madam.
Yeah.
Yes, that also.
Yeah, it's a negative compliment, isn't it? You're not supposed to achieve that. Oh, you managed to achieve.
Through this,
isn't it?
Yeah.
Yes. And since we are into marital counseling also, we often come across this. It's in a domestic scenario, but then I thought, since it is on the fears that lead to biases, the wife would like to have a sharing of the work and making a cup of coffee. The apprehension of the man is, what if she's going to ask me to make a cup of coffee all the life? It's one kind of a fear which prevents them from even getting started. Because I make one cup of coffee and it turns out nice, then they may ask for the second cup of coffee, and on and on. That is one fear. So that's about the fears. And actually Pratima had touched on it. But Madam Dr. Kadambari, what do you think of this patronizing attitude? Is it an antithesis? Because she said that sometimes they would go all out to help, and you are to be protected, you are to be what to say, helped or lifted up. And what do you think of that?
Yeah. So what we should be looking at probably is not to say that one gender is dominant over the other. And what we are looking for is the term we are using is equality here. So we don't want to be looked at as the weaker sex. I mean, we don't want to be, whether it's physically or whatever, whichever way. We don't want to be like, I don't want somebody to open the door for me when I'm coming out of a room. That's not the thing that I'm expecting from a male colleague. I'm expecting respect for my capacities. I'm expecting an acknowledgement of what I can contribute to the workplace, and not look at me as a woman. Look at me as a colleague. Look at me as, if I'm in a leadership position, look at me as a leader. Give me the respect that, of for what I'm being able to contribute, or what I'm bringing to the table. So this kind of thing, oh, she's a woman, so we have to adjust or give what shall I say, allowance to her, the emotional outbursts that she will have, or the histrionics that she will display. All these things are sort of attributed to women. And so I don't know. So I can see Dr. Puneet has put all ladies love a chivalrous gesture. Maybe from my husband, but not from every male colleague around. Yeah. So in fact, my daughter is also, she's in her, she's just reached 30. And so when I said that, there should be one of her male colleagues in her office opened the door and said, please go through. And she said, why is he opening the door for me? I'm quite capable of opening my own door. So I, so I realized it's true. I mean, there are some things that we learn from the younger generation also. And it's true. Why do I need people to, yeah, that's true. Somebody has said, why do we need men to mollycoddle? No, I don't want them. I don't need that overprotectiveness. I'm quite capable of taking care of myself. Just don't trouble me, that's all.
Thank you, madam. We have Dr. Kaushik Bhattacharya. Sir, would you like to give your...
Thank you, Dr. Vidya. I was hearing the benign version of bias till now. I'd like to touch a little bit of the malignant version of the biases which is occurring, Dr. Vidya, if you allow me. Now, there is a word called surgical sexism, which has come now. Now, surgical sexism is a word which is now prevalent in Canada, and they have published a paper. We did our own findings, and we did in Indian Journal of Surgery, we published this. Now, that's a completely different way of looking at it. That means it is affecting the salary of a surgeon. I mean, surgeon's salary is affected if you do a surgery on male patient versus female patient. So that type of bias, I think we have not discussed till now. That's an entirely different where, for example, a surgeon doing an ovarian cancer treatment is paid less than the same surgeon who is doing a testicular cancer treatment. That's a very different type of bias, and they are facing it. The female patients, the female doctors there are getting almost 30% less professional fees for the same surgery what is done in the male counterpart. So that word has come called surgical sexism, and is very common. It is not. I'm not sure how common it is in India. We were just trying to rule out if something is happening in India in the same version. For example, you giving an anesthesia to a male patient is paid less if you give an anesthesia to the female patient. It's something like that. Where our salary is being affected, our professional fees is being affected, and the entire Canadian person are knowing it, and they don't know how to protest. So that type of bias has not come to India. I'm not sure. It may come in future, and what is the thing? But that term has come called surgical sexism. I wanted to introduce to all the panelists today that this is in future. And number two is, I think the sexual harassment.
I think Dr. Kadambari.
Yeah. Go ahead, madam.
Yes, sir. Go on, sir.
There's another thing. I don't think Dr. Vidya today is a part of your discussion, that is sexual harassment. Is it a part of today's discussion?
we already had a session on that few weeks ago.
Okay, so we'll not discuss about it.
Yeah.
Thank you, madam. That's all I want to say. Thank you.
Yeah. Actually, the next question, incidentally, there is also a comment on culture women. So to mark women who have internalized patriarchy, that they are happy to receive the male gaze is one comment. And incidentally, the next issue that we are going to touch upon is to Dr. Pratima. What do you think of women who take advantage selfishly, citing gender? That's also there, isn't it?
Yes. So, yes, it is again, we go back to the society when we are given some female ladies coach, everything ladies, so ladies quota. So many things have been like instilled from the society into the female brain. So sometimes, yes, they are slowed down by their maternity leave and other things. They start very slow. But once those things are done, they just go up very fast. And we know that the focus of the work increases after that. Maybe in the subtle period of time when they want to take a short route, they use this gender. Why not? As some people. And I don't think it is widely practiced everywhere, but definitely females do give females another small tip saying that, yes, you can go into this female quota, female line. Everything is shorter because yes, a female line is shorter. So I think they can reach their destination taking a shorter route. One is that. And second thing is again, patronizing comes in when they think that females have a low ability to do stronger things. So that is how they start taking that and slowly they instill that, and it is really poisonous. And I personally do not advise or support that. Definitely it is done. We should openly accept.
Can I give another point of view, Dr.
Yes.
Kalavathy?
Yes, madam.
So this thing about having a separate line, separate queue, and having a separate, bogie in the train, which used to be called the ladies' bogie, etc. I think that was a result itself of the sexism they were facing. So all of us remember when we were teenagers and we would stand in the line, or when we used to sit in a bus. There would be some creep sitting in the back seat who would reach out and try to, do something funny. So it was to deal with this kind of behavior. And it is just that the men would get away with these kind of behaviors. And some of us, again, it's the conditioning that we faced. Some of us didn't have the thing to pick up a fight with them or make a noise and things like that. So I think there is a role for these kind of quotas and things, because that is probably an intermediate step or a very preliminary step that we need to take till we reach the utopian state of equality. So, yeah.
That is one aspect of it. Another aspect of it is using gender for an unfair advantage or an advancement, or to get away with not doing enough or what is required for that job requirement, citing gender. So we
that
find
can happen with any kind of reservation or quota or anything. People can take advantage of that. That is some of and it's the other side is also there. You give a quota, like we have the women's reservation bill. One of the fears is that this becomes more of a mechanistic reservation, that you show your numbers and say, okay, so many seats, but who has picked them? It's the men who have picked them and decided that, okay, you occupy this position. So even though there are pros and cons for every policy that we make, it's a question of maybe experiencing them, and then we can't anticipate everything that happens, but then somewhere we have to make a headway. So it definitely has. Yeah, people do take advantage of that, as in any other quota system. Yeah.
So if I can just interrupt Kalavathy, Satyanarayana has a lot of comments in the chat box. So one of the things is work time parity. I think that is one of the points that you were also trying to pick up about unfair advantage. Like,
yes.
you always need to leave early, or you won't do a night shift, or I mean, it's different. Pregnancy and immediate childbirth apart. I think those are also issues. So Satyanarayana, and if you're fine with unmuting and speaking, please go ahead. I think you have been the subject of gender bias just because of the choice of your profession, and you have made many insightful comments in the chat box. So if you're free, please unmute yourself and speak.
Good evening, madam. I am available. Thanks for the opportunity to calling me in for this wonderful discussion. I have never been treated unfairly just because
Can we
of my
see
gender.
you, Satyanarayana? Can we see you? If you're presentable, that is.
Yeah, very much. Just give me a minute. I'll have to switch on some lights. Yeah, there I am. I hope I'm visible now.
Yes.
Yes.
Yeah.
Yes.
I'm working in Rajiv Gandhi Hospital, Pondicherry. I'm alumnus of JIPMA. Having brought up in a very wonderful environment throughout my undergraduation, post-graduation, senior residency, I have never felt I have been discriminated gender-wise, and neither have I. It has inculcated the right mix of what to do, what not to do, exactly like what our Professor Kadambari told, holding the doors. Some people consider it chivalrous. Probably yes, maybe even 15 years back. But nowadays, it is more like a habit than which I would like to let go. If the woman objects, yes. If my colleague objects and tells me in a way that it is understandable, I definitely can leave the door unopened for her. But if I'm trying to pass the door first, and if the automatic door is going to shut down back, that is something which I'll do even for a male colleague, not only for a woman colleague. So I think I strike balance there. And it is not only in our medical profession, it is basically in mostly all the professions. It all started with men. So definitely when a woman comes into that particular profession, into that particular circle, whichever strata they belong to, there is bound to be some kind of a bias in the beginning. I think women are now empowered to strike out that imbalance, get communicative, and get through this affair. I think I've spoken enough.
Thank you, sir.
Thank you. You can call me Satya.
Okay. Next, we would like Dr. Harapriya to speak up. How do we view the allegation that women want to do everything a man does? Yeah, so that we frequently hear as a complaint also. And is it that women want to occupy every place that man is occupying, running behind him, or is it that they want to take over? What do you think of this? Or
I think
is man
whether
the
we should
reference
really
that
even
we want to do everything the man does?
Yeah, I get your question. So I don't think it is the idea that woman wants to do everything a man does. It is just opening up of opportunities. Earlier, many years ago, many women were not going into super specialties. I mean, in fact, they were not even going beyond basic medical school. And then there was a time when women specialized into broad specialties, and now there are women specializing into super specialties. So once there are more, it is just an opening up of opportunities. It is not like just because men are able to do it, we also want to do it. It's not that. It is just basically, I feel, a huge opening of opportunities. But again, even these women who are in the super specialties have not had it easy, actually. In fact, when you see there are so many groups like women in cardiology, women in nephrology, the fact that they have to, form a group like that to feel empowered itself shows the major bias in so it is not like exactly they want to do what the men want to do. In fact, I would think on the reverse, many men want to do all that women want to do. I mean, I have seen many colleagues, junior colleagues, who want to take permission. I want to accompany my daughter for vaccination. I want to accompany my daughter for the first school meet. I'm sure these things are actually increasing as well. So I think it is both ways. So it is just what I would think, basically, it is just the huge rampant opportunities which has actually driven women into more areas which the men may look at it like you want to do everything the man does, but it's actually not true.
You said there are more opportunities. They did not come automatically, isn't it? It has evolved over time, and there are more opportunities now. Down the lane, if you go back by about 20 years or 50 years, the opportunities were not the same, isn't it? How did it come about? It was not the easy way, isn't it?
Exactly. So, I mean, they've definitely come the hard way, but then once they've taken that step, they know that it is not something very unachievable. So it has become easier for the rest to follow as well, I'm sure. So it has not been an easy way, definitely, but it has evolved over the years, and that is why we see I was telling the group about like how many we have a DNB cardiac surgery program, and 1 out of every 2 candidates every year is a female. Earlier it was not even heard of, like girls would take cardiac surgery, but then we have these girls who come into the specialty just because they have an opportunity, and then they evolve very well. They really become real gritty cardiac surgeons, and they put up with everything what is required to be one. So we see all types actually.
I have seen some of my female colleagues. Yeah, they have stayed back for the afternoon shift, and it gets over a little late. But then they stick on to the duty. Don't make any excuses, and means fulfill their duty. And yeah, it's been also a matter of personal conviction and integrity. This job is assigned to me, and I will not make any excuses nor cite any excuse, and do my job. So I have seen people like that also. So it is
Kalavathy,
very heartening to see that.
can I just interrupt?
Yes, madam.
Yeah, we have Dr. Anika, a young orthopedic surgeon. Like
Yeah.
actually, I have hardly the first orthopedic postgraduate I met was when I was finishing my senior residency in JIPMA. We had just one female orthopedic surgeon from the Northeast, and she was the only female orthopedic surgeon in the Northeast for a very long time. I don't know whether the situation has changed. Anika, if you're free, we'd like to hear from you. What made you take up a specialty which has been traditionally taken up by males, and definitely there is some physical part also involved in it. There's a lot more physical demands made in orthopedic surgery than in other surgeries. So Anika, if you're free, we'd like to hear from you.
Good evening, everybody. I actually just finished my post-graduation last year, and I'm working in Bangalore right now.
I may interrupt, Dr. Anika. Can you on your video, please?
Yes, sorry.
Thank you.
Just 1 minute, ma'am. Yeah. Hi. Sorry. Yeah. So initially I took orthopedics because I was really into sports, and that's why I took it. But after I joined orthopedics, obviously the grind of any post-graduation is quite bad and severe. And any department, not only orthopedics, take it ophthalmology or obstetrics and gynecology, it's actually quite severe everywhere. But I think once you get through that phase, actually, I haven't experienced this bias that y'all. Actually, I've been listening to all of y'all speak. I haven't experienced this bias through PG, UG, PG, or even the workplace I'm working in currently. And maybe because all of these are institutions. So, and from, I mean, I think this generation is going ahead. And I don't think there is any, I mean, till now, I haven't felt anything. Of course, like the place I'm working in, I think I'm the only female orthopedician they've ever seen. So they keep asking me, oh, why orthopedics? Why orthopedics? Like there were so many other things you could have taken. But then this is what I like and I love. So I enjoy it. And I've I'm not married, neither do I have any children because I'm not married. But I've seen other seniors of mine who have done super specialties and other orthopedic women. Like where I studied, we had a lot of other women also. So I had that support also. And they were married, they were pregnant. I mean, we have the exposure of C-arm and all of that, but then they were not posted in cases with the C-arm. So everything was quite well. So I think even now I mean, even the men in our department, they had paternity leave also adequately. So I think maybe I studied in good places, so I have no complaints.
Yeah, it's good
Yes.
to know that there is light at the end
Yeah,
of the
that's
tunnel.
nice.
And Satya, you have your hand up again. Did you want to say something?
Yeah, this is a request rather than something which I wanted to share. I noticed all majority of them speaking as women or in such equivalent words, but some speakers I do not want to name are using the word female. Even that is sexism. I hope I have conveyed a point. So
Sorry for the
all those who
interruption.
have felt,
Yeah.
all those who have
We
felt,
got the point, Satya. Over to you, Kalavathy. Sorry for interrupting. Back to you, Kalavathy.
Dr. Neela Bhattacharya is here, so if she can also share her view. Dr. Neela Bhattacharya.
Can we see you, Dr. Neela?
Actually, I think the network is poor. We can't even hear her properly.
Yeah.
Yeah.
Yes. So Dr. Neela Bhattacharya is a plastic surgeon, and how she was able to go beyond the grass.
She's Dr. Kaushik's wife, by the way. Yeah, we can't hear you, Dr. Neela.
So meanwhile, Dr. Eril.
Yeah.
Dr. Eril, yes.
Okay, yeah, thanks for giving me the opportunity.
Dr. Eril is my
okay.
He's
Thanks,
my classmate,
Kalavathy.
and yes, he practices in the UK. Thanks for joining, Eril.
Okay, thanks, Kalavathy. Just wanted to share my view. I mean, obviously, I trained in India, but I've been living
He's
in
a
the UK
psychiatrist.
over the last 25 years. Yes. So I thought, I'll just share my view about, various issues we are talking about, gender equality. Very good point, actually. We started with Kalavathy saying about things starting at home and how, our home culture and even movies, the image of a macho and everything, man and everything gets glorified. I don't know if how many people have watched the recent super hit movie Barbie, which talks the other end about female feminism and other things like that. Definitely, there are issues around inequality either in the eastern, in India, probably even in the Western world. Even now, even especially about medical thing as well. There was a big paper in the UK about how female surgical trainees were harassed and how they are disadvantaged even in developed countries. But things are being addressed not only in medical but generally. If you look at the Western cultures, there are much more support in terms of part-time working, paternal leave, like one of the speakers said. Those things are being considered. Maybe those are the things which in India we need to go through. But just one thing, just a point to mention, depends on equality. What is the outcome we are measuring? Is it the maternal? It is a materialistic equality we are talking about. Then one might question: is materialism the answer to how you measure the outcome? So it all depends on the outcome you are measuring. Or are we saying happiness and give and take? Is that the outcome we require? Because as you can see, the more I don't have a research on this, but generally the more equal society is, there's more divorce rate and single parenthood families. So I don't know whether what association is that and how to do that. I know that's not the talk for today. Again, in future, theoretically, for example, if you talk about, for example, men wants to breastfeed. So I'm sure there'll be issue that are we naturally disadvantaged by not doing that? I want to experience that motherhood sort of thing. So it all depends on the outcome and other things. So just wanted to share a few points. Thanks, Kalavathy.
Thank you, Dr. Eril. I think that can be the topic for another day, because it's a huge one and by itself. Now, Dr. Neela, if you have any inputs, we would like to hear from you.
Yeah, I just switched rooms, so I got onto a better microphone, I think. So we are talking about bias in gender, and I think a bias in gender is going to stay for eternity. I don't think whatever we talk and whatever we discuss, it is going to disappear in time. It may be essential also because by physical attributes, by our other things, men and women are different. So I think it is important to realize that and appreciate that also. That is one. But a woman or a man can do whatever they want to do at this present scenario. Initially, when I took up surgery nearly 30 years back, there was a big hue and cry. I was the first lady surgeon going into Orissa to do surgery, and they did not have any provision to have a lady PG. And so they said, you're going to be insincere, you're not going to continue in surgery also. So that is what is the initial bias. But then it only just took me 2 or 3 months to make them understand that I'm as equal to all their other male PGs that they had, and the bias stopped. That continues for life. Wherever you are, the way you work, the way you get along with people, like that young girl said, the situation is much, much better for the youngers. Actually, the Anika, I think, she said that she did not experience a bias. As the generation has become younger and younger, with when the whole society is seeing women in all these roles everywhere, now we don't, I think, flinch when we see a female pilot. But that was when we were growing up, we have never seen female pilots. So this is what is the general thing. The bias will stay, but bias will disappear if you're able to prove your worth. That is all I think I have to say.
We have reiterated again and again that the younger generation is having it a lot better as years go by. So, Madam Dr. Kadambari, what is your take on that? That the younger generation is having a lot better than what it was 10 years back or 20 years back?
In terms of opportunities, maybe yes. As Dr. Neela just mentioned, when I did my PG, I was also the only female woman PG in surgery almost 30 years ago. So it was a rarity. Now in my college, almost half the postgraduate students who join surgery are girls. So definitely in terms of opportunities, things have improved. But I think sexism has taken a different form now, and maybe we had it a little easy. I did not face sexual harassment as it is in its strictest sense. But today, especially as a senior person in the department, I do get a lot of young PGs coming and telling me about instances where they have faced sexual harassment. So I don't know. It's just that there are more girls around. So what is the reason why this is happening more frequently? When I was alone, I didn't have this problem. But now there are 50% girls and they are facing this problem. So it's not that it is removed or it is gone. It has just taken another form. That's all.
I think Dr. Jayanti is also here.
Can I
yes,
just say,
yes.
it is an important time to compliment like pioneers, almost pioneers like Dr. Kadambari and Dr. Neela, because they did have the guts and they did their hard work during 30 years back. I cannot even imagine what they went through, but yes, it was very tough and they put it very simply and subtly. It is because of them, I think, people like the next generation, Dr. Anika, is not having the gender bias as much as they faced. So I just want to compliment, I just take this opportunity to compliment and give a big salute for them.
Imagine being the only female in a class of 150 or 200. That's how it started, isn't it? When women entered the field. So You
So
need a lot
there
of
was,
confidence
yeah.
to face it.
Vidya is mentioning Angeline here. Angeline was a 4-year senior to me, and she was the first, the only woman PG in surgery in JIPMA when I was a undergraduate. I did my PG in Stanley Medical College, Chennai, and I was the only woman at that time. But Angeline was also, and before her we had Margaret Topno, who was another single, the only woman PG in surgery in JIPMA. So we were isolated women PGs. But now things have improved. Women are entering surgery more, and probably because they don't feel that inhibition. You know, many of my seniors and even my own mother was very apprehensive when I chose surgery, because they all were afraid that this is a male dominated field and what kind of problems I will face and all that kind of a thing. But I think that has definitely changed. That concept of it being a male bastion has definitely changed.
So Kalavathi, Dr. Angeline is here. She would like to say a few words.
Yeah.
Go ahead.
Yes. Go on, madam.
Am I audible?
Yeah.
What I agree with Kadam, it was a lot of hard work. But one thing, if at all we claim to be tormented, it was from our colleagues. It was never from our chiefs. They were really very nice. They treated us equally. In fact, I even found some of them to be quite caring when we were going through motherhood and problems, because they could spot when you were telling the truth. They could also spot when you were telling lies. If you say my child is sick and go gallivanting somewhere else, they could easily see through it. So that way, like, I had no issues. We were very happy. The contemporaries are okay. They have moved on in life. I have moved on in life. No hurts. But what takeaway I got from working from male surgeons was that masculine energy that sort of seeped into us when we were at a very receptive stage. And we were able to stay afloat because of that. So I thank all the male chiefs who tutored us, who mentored us, who silently, gave us that male energy.
Thank you, Angeline. Over to you, Kalavathi. Sorry for the interruption.
Yes, madam. I think Dr. Jayanti is also here. Madam, would you like to give your point of view, Dr. Jayanti? Okay. So, once again, I want to reiterate that this is not...
Can I ask a question? I am Ravindran here from JIPMAR Pondicherry.
Yes, sir.
I would like to ask, Kadambari. Your statement, regarding the opening the door, it leaves many people. I'm not only you. There are many have that kind of views, and it leaves males confused. Because one man, male should be a gentleman, and he opens the door when a woman comes. Okay. And now the things are changing. Now, why are you opening the door for me? And then they're yelling at the males and this thing. I am also now getting confused whether I should be a gentleman or whether it should be, suppose I don't do it, there is a possibility that I will be called rude. So whether I should be a gentleman to a woman or I should be called rude by a woman, I don't know. Number two, I would like to, just a minute. No, this is not, this is not a very important thing. The question which I am going to ask is very important in my opinion. Suppose you are a conference organizer, okay? Of course, the whole department has to work. This is a national conference or international conference. Now, there are things which have to be done in the night. Maybe you have to go to somebody has to go to the stand, receive somebody, or a railway station in Pondicherry and some this thing. Now, will you assign it to a male PG or a female PG? Yeah.
Okay.
Yes, Kadam.
So, yes, sir. So, regarding the first question, I think the idea of chivalry and being a gentleman is itself based on the premise that women are the weaker sex. And our refusal to have men opening the door for us is an objection to that attitude. So I would definitely be happy to open the door for a male colleague who's coming behind me. I'm perfectly fine with that. But don't look at me as a woman who needs the door to be open for me. That's point one. Regarding the issue about sending a woman PG or boys to pick up somebody from the bus stand, etc. Again, society is definitely sexist. If a woman is walking alone, in the road, she is vulnerable to a male or a group of men who are going by. They will not leave her alone and say that, okay, she's going to do some work. They will definitely
I fully understand. No, it is a society. Okay, you can blame it, no, entire thing on society, not an individual. Because individual actually, suppose if I were in your position, if I am in that position, definitely I won't assign a female PG to go on this thing. Definitely not. Okay, fine. Then in that case, you say that no, the opening the door, no, don't look at the female and this thing. Suppose a pregnant woman gets into a bus and now it is fully occupied, and if a male gets up and then gives up this thing, will it be seen? No, it's a woman, pregnant woman, no, is being given a seat, or how do you look at it?
I would get up for an elderly man, sir.
You. Then at the time, no, you don't consider that no,
not
because
at all. It's just being humanitarian. It's just being human. That's all.
That's what I'm saying. Sometimes it is very confusing. It is very
not at all.
No, whether a woman will think me as being correct, will judge me as correct or wrong. No, the many times it leaves people confused. I don't know how many males in this who are listening to this agree to it. Sometimes what say whether this woman, whether she will think, I mean, if I open the door,
Dr. Ravindran, your point is well taken, that sometimes there are mixed signals, and since we are in transition, we are dealing with men from different generations and women also from different generations who have been conditioned differently. And so there is going to be a temporary situation of confusion before things become more clear. So at this point, I'd like to invite my non-medical friend, young friend, Shweta Sridhar. She's specifically specialized in gender studies. So I hope you've been listening to all of us. I'd like to give you a few minutes to just put everything in perspective as a non-medical and as a gender expert. Shweta, are you there?
Yeah, thanks everyone. And it's really been a pleasure to listen to so much of this conversation, and it's, some really interesting insights for me. I think when Dr. Vidya first sort of invited me to be a part of this conversation, she said, oh, we're going to be talking about gender bias in medicine, and just given my training from a rights perspective and from an access perspective, my first thought was about, the scientific body of medicine, and like how as individuals, when we interact with that, what are some of the biases that come out in that conversation. But it's been so fascinating to be a part of this conversation and think about also representation within the practice of medicine, and how as women doctors and as healthcare providers, that experience is something completely different as well. I mean, I had some broader thoughts that I think also are, relevant to the conversation around representation, about how women get treated within, say, spaces of academics, say, practice, in promotions, all of these things. And I think some of these things have already been alluded to in terms of the pregnancy penalty, in terms of the patriarchal bargain, where women are often harder on their women colleagues because they see some of those, decisions that they themselves have to make. And I think the one thing that I would like to put out there is that it's easy to isolate these as individual choices and say that, what would you do in this situation? Or can a woman break a glass ceiling? Or, who do we promote in this one instance? But I think the larger question is, why are we having to make these individualized choices so important? Like, why do single choices that individual women make mean so much in a larger context? So it's not about, why does, for instance, a woman choose to give up her career or take on part-time work It's not because she's instinctively more maternal. It's not because of anything that is innate in her nature. It is because there are certain structural forces in society, be it lower pay, be it the expectation that she will be the primary caregiver for a child. All of these things play into the fact that she is making specific choices at her workplace, in this instance of being a doctor. And I think that as long as we continue to ask the why, which is the secondary question, which I think Dr. Kadambari also put really well just now, it's not about will you send this person versus this person. It is about why is it difficult to send person X versus person Y. And all of that feeds into the bias that we have as practitioners, as people who interact with the medical system. And as people who are just trying to live our lives on a daily basis, honestly. That was my very quick thought. I had some other things but I don't think I'll touch on those now because, the conversation's gone in a completely different direction. And this is really interesting to be a part of. So I won't bring it back there.
Thank you, Shweta. Over to you, Kalavathi.
Yes, madam. But I want to reiterate again that this is not any male bashing forum. It is just that we are going to bring out a bias, as we just simply put it. So I want Dr. Harapriya to address this. Each gender has got its uniqueness, and each gender has got its limitations. What do you think of that?
You need to unmute yourself, Harapriya.
I'll do that. Yeah. So that's the main crux of the concept called inclusivity. So the main reason why we need the input of both is because one will complement the other. So it is definitely true that we have to recognize that the uniqueness in each sex is entirely different. What they are capable of, what they can bring to the table is definitely different. And the more important thing is how both the genders complement each other. That is where we can take the society forward, definitely. So how they try to understand and support each other's limitation and try to recognize each other's contribution. That is what is more important, I feel.
So are there any uniqueness that a woman brings and any uniqueness that the man brings to the table?
Like Professor Nandi told in the first comment itself, he would take a woman because she would be more sincere, she would work harder. I think such kind of biases against women are there even among women themselves, actually. So it is true that it is definitely true. I'm sure all of us women will agree that we can multitask better and we can manage more things at the same time. And those things are definitely our strength, definitely. And of course, the uniqueness of male, I'm sure there are a lot of people who are going to contribute to that point as well. And it is true that we just have to recognize these things and make it useful for each of us.
Dr. Murli, would you like to come in just now? Dr. Murli Krishna?
Yes, ma'am. Yeah. Hi. Sorry.
This point about uniqueness and what each gender brings to the table, would you like to say something on that?
Yes, it is. I mean, it's very true, especially, each gender has got its own uniqueness. Women are more good at multitasking, and what they bring to the table is very different from what men bring to the table. And so I think specific jobs require specific roles. And I'm sure that, with this balance, we'll be able to, work on both of us can work on the specific, based on the uniqueness of each of the gender. I think these things can be balanced.
I think if both the genders realize that there is uniqueness as well as there are limitations to both, and that limitations are not only to one particular gender, and uniqueness is not with only with one particular gender. If you recognize that both the genders have both, then it will balance out. And accepting that I may have limitations, and I also have some uniqueness. It brings a kind of a balance in all areas. So I think it's very important to have that orientation.
So, Dr. Kalavathy, we are kind of out of time. So, if you have any points that you would like to discuss, can we just quickly go on? Anything that you had planned and got left out, maybe we should address it now.
Yeah. So I would like Dr. Murli to address this. Are there any losses by having a gender bias? And what advantage is there in inclusivity?
Ma'am, the numbers are actually mind-boggling. All over the world, if you the loss in gender equality is close to $162 trillion, just because men have not given equal opportunities to women all over the world. The loss is equal to $162 trillion, which is almost the GDP of the whole world. So, I mean, slowly, I think all corporates and all governments are realizing this, and there is scientific data to prove it, and that's why the inclusivity that has come into in several fields of in the business, and I think same thing is happening now in all fields. And medicine, I think, is forefronting that, if you would ask me. So as far as your last question, I think sponsorship, mentorship, and scholarship are three words that that Times Magazine has actually once said, which can help us cross through this gender bias. By sponsorship, what it means is that women and men equally participating in bringing up other women, making them part of all projects and researches and things like that. Mentoring, especially the women leaders who are already there, mentoring their their fellow colleagues and their juniors to to reach up to their level. And scholarship in various forms, as we discussed it, giving a quota, giving encouragement, giving specific allowances for women, are these three things that are going to make a difference, in crossing over this gender bias, at least in the developing countries.
So how do we strike a balance? And
the balance is already, to be honest, the balance is already there, if you would ask me, in our fraternity as well. If you would ask me, it's taken a lot of time, but now I think we would not flinch eye if a woman is there in any field in medicine. We have seen them grow over and perform better, or if not equal to men in all subjects. So I think. And now I think from now on, it's a time of gender equality, and probably a time when men will slowly become the weaker sex.
it's not that is not the idea, that is not the intention.
I know, but it's a reality, actually. Yeah.
That again makes it lopsided. So I think
I'll just interrupt Kalavathy. Ilango had a question right in the beginning, that all you women who have reached whatever stage you have reached, he wants to know from you, how did you overcome gender bias, if any, and what tips you have to share for the next generation? Ilango had asked that question long back. I don't even know that he's still here. And after that, I'd like to hear from Venkatesh. He's been typing on the chat box, but Venkatesh, please be ready. We'd like to actually hear from you a concise summary of what you have been typing. So we'll start with Kadambari, because among you, she's the senior most. So off you go, Kadambari.
Okay. So in my case, at least, when I took up a so-called male-dominated field way back, and even before that, when I was growing up, I had a lot of strong women in my family who didn't look at us any differently simply because we were girls. And so I grew up always believing that I'm a strong person, and not necessarily that I'm a weaker sex or whatever that is. And and a lot of credit also goes to my father, who was a very strong feminist at heart. So one important factor is the social and family support. The second is the when I was training as a PG, I had a lot of male colleagues who never looked at me as a woman, and we were, sort of looking out for each other as we do, as all residents do. So that's kind of support from colleagues also helps. So apart from that, it is also an inner resolve not to allow this to overwhelm you. And it is basically it is a way of resisting whatever these kind of negative experiences that we face. And as somebody rightly pointed out, our women role models. So in my workplace, among my teachers, and I can acknowledge her, Dr. Gitanjali has been a major role model for me. And she has actually in her own, without actually putting it in words, but the way she carried herself, the way she went through her career trajectory has been a big source of inspiration for me. And so I have shed a lot of my inhibitions to speak up and to assert myself, and to, so role models are again a very important thing. And then once you get all this gray hair, then you have less people listen to you a little bit more than when you were much younger.
Yeah, I think one key word is not being overwhelmed. So I think when that is there, then it gives the strength to go on also in spite of all odds, in case we are in that kind of a situation. So thank you, Dr. Kadambari. Anybody
Dr.
else?
Kalavathy, can I say one thing?
Yes, ma'am.
Yeah. So one of the things which I have noticed is that many times women don't step up to leadership positions. So this is one thing which I would like to tell everyone. See, when there is an advertisement for a leadership position, go and apply. The next steps come later on, whether they call you for an interview, shortlist you, you accept, you get selected, you accept, join, all those things come late. But the point is, when you see, especially senior leadership positions, you will find only men applying. There will be one or two women who are very, very hesitant. So that's the whole problem there. So especially medical leadership, hardly any women are there. So one of the things I would like to put up in this forum is more women should apply, and then think of the rest, whether you want to join or nothing.
I think
Thank
probably,
you.
Thank you, ma'am. I think that is probably an innate diffidence because some statistics show that if a job criteria is made of a number of criteria for that job, if men fulfill 60% of those criteria, they proceed with applying for it. Whereas women on the same level, if it is 60%, they are very hesitant and they don't even attempt. They aim at fulfilling all the 100% criteria before applying for the job. So this has been a difference which is there. Yeah, it falls in line with your observation that women don't take up leadership positions. Yeah, anybody else?
Harapriya and Pratima, you're probably going through that process now. So would you like to, Pratima, your mic is unmuted, so maybe you should go first.
Yeah, so yes, I can relate a lot of things what Dr. Kadambari madam said, maybe not to her level. I did have a strong woman as a mother. So she had been through a lot when she just keeps saying her experiences. And she also, one thing which I noted what my mother did is she also instructed a lot of things and taught a lot of things to my brother as well, how to behave with women. So that is also very, very important. I had a father who had constantly been motivating me. It was never unequal at home. That was kind of blessing and curse as well, because when I entered the society, when I was totally in college, and when I was getting into more and more focused field, I faced a lot of gender bias. I went into MBBS. Yes, MBBS was very, very happy, and it was all green. Then when I went into anesthesia, yes, people started asking why anesthesia. But already there were many female colleagues and very accomplished lady anesthetists. who were already in the profession, so I could enter that, and that was like more than 15 years back. Then when I chose critical care after that as a super specialty, I got a lot of negative motivation from my own friends, lady friends. Women were they were just telling us a concern, like, please do not go there. It is more of a male domain. They call it more of what to say, it is all like you have to be running with, if you are running a race with a mixed population, it is okay, but if you are running a race with only male people around, you might fail. And it is very, very difficult when we stand in the middle of the ICU and talk to, I'm an intensivist now for the past 12 years. When I stand in the middle of the ICU and talk to my male colleagues once a it's like when I started, people, when they entered inside, the physicians were, male physicians were looking for even the female or the women. So you don't want the word female. So I didn't know, it was very hurtful. But I use it with very respectful terms. When I stand there, even all the physicians, when it is whether it's a male or a female, they just enter and look for another male intensivist who is able to control the whole ICU, who is able to take the severe pressure of the ICU. And it took a lot of time, persistence, and they literally, they took a lot more time to accept and realize that I had the equal ability to work there and take very good decisions. And now I'm really proud of where I'm working, and we do not, as Kadambari madam said, nobody sees me as a lady anymore. They just see me as an equal. So whatever I say over phone, or even I say, I will take care, don't worry, they just accept, and they do not question, or they do not have second thoughts. So that is how much I have been persistent, but it had been a very rough patch. I do not want to really go into minor details, but persistence, availability, and a lot of family support, and my wonderful husband, I really have to mention, because he is not a person who has that bias. It is not, I can't say that he supported or gave life to me. He literally respected my, what to say, he respected my preferences, and he never disturbed me. So that is what, he is an anesthetist, I'm an intensivist. I did super specialization. He has not done a super specialization, but he was a very big motivation or a driving force, and a very good, what to say, cushion when I had a lot of rough patch. So he was always a lubricant and made my life more easier. So this is what I went through, and I'm proud to say that I am really, I have good satisfaction in, and I'm thinking I'm starting to make a mark in intensive care, and I really want more women getting into this. And not many places in Chennai or wherever I know have a female coordinator for more than 2 to 3 years. I've been one, and I'm able to do good work. Thanks for everything, and thanks Almighty.
Thank you, Pratima. That is another encouraging story. Anybody else would like to?
Harapriya, cardiology is, I don't, literally, cardiologists, female cardiologists aren't dime a dozen, even now. So
are actually a plenty. In fact, I should say pediatric cardiologists are predominantly becoming a female specialty right now. And in fact, if, I mean, like, I agree with all of you, it all depends from our social construct, how we are brought up. All those things are, which instills the kind of bias or the will to overcome the bias. Definitely, I was fortunate to have the will to overcome the bias at all stages. And when I did a specialty of pediatrics, again, it was all only, a lot of females around. I was fortunate for that. In fact, I should mention one male registrar whom I had. The moment I came back after marriage, he pulled out a prescription and started writing. I actually assumed he's writing a prescription for OCPs. Actually, he gave me a prescription for folic acid. So that was very, very encouraging, actually, from a senior colleague, definitely. And of course, right now in the specialty as such, I'm sure. And the thing is, when we are working in a teamwork like a cardiac surgery, we have so many surgeons, the high egoistic cardiac surgeons and cardiac anesthetists and different types of people. And we do have, we kind of get tuned to emphasize our role and to show our presence there. I think in this specialty over the years with a lot of colleagues like this, I have actually grown a lot in personality and everything. And even in those times when we deal with very like a high intense specialty like pediatric cardiac surgery, and we have different types of results, we have mortality, and there is always the family who actually runs to us. They actually run to the pediatric cardiologist, in spite of a lot of people in the team. They find it somehow comfortable to talk to the cardiologist who has first seen them. That kind of vibe, I think we somehow give to the families, in spite of all the intense thing around the specialty as such. And of course, I have raised two lovely girls. I think being a parent to two girls has actually made me think and grow much more in this gender bias thing, definitely.
Dr. Puneet, you had your hand up. Did you want to say something?
Yeah, I mean, I think we're already short of time, so I put it down. But just to, we had a session with lady surgeons. We did a small conference on women in GI and HPB surgeons to see that what problems they have and how we can sort it out. So some of the action points which came up, and I think somebody put them in the chat box. They didn't come out in the in the conversation. So I thought, for the subsequent YouTube thing, we should document it. One is, I think we need to see the actions. There is a difference. There is a bias. I think both are not going away anywhere soon. But we need to address how we need to sort out. So I think the action points, one important thing which came out was the childcare facilities at the workplace. When I was in Amrita, Cochin, my kids, when they were, I think, 2 and 7, and we fought for a creche, and by the time I left it 22 years later, it was there. My kids were ready to have kids, but it still did work out. So I think we should all work towards that. That's one important thing, because that lets the lady, helps her in that. The second thing which came out was, we all talked about role models, but having female mentors actually seemed a very easy way out to help out the youngsters. So that's one way, they can address the bias. They can make the person feel actually there may not be a bias when it is perceived. So there's a balance is brought about. And the third is the social media depiction, media and social media depiction. Famously in the late 40s, there was this movie called Adam's Rib, where two lawyers, the husband and wife, are fighting a divorce case, an attempted murder by a woman who's suspecting the husband of adultery, and it actually tears their own home. So it brings out where people who think they are woke are actually may not be that woke. So I think all of us, my sister, mother, daughter, wife, they've all been broken some glass ceilings at some stage. And each of them brings home to me that I may think I'm woke, but probably I'm not. Lots of times those bits come through. So I think keeping on having fora like this is very, very important to keep the conversation going and making people realize that there is an issue. So I think media is movies are a huge, I would love if some of you actually produce a movie, to show that this is a huge problem, because in some states there is such a backward view of women. If my wife is driving a car and we are stopped for something, the guy will look at me in the passenger seat and talk to me. So that's how bad it is. So I think we need to address those in radical ways, and possibly there are easier lower hanging fruits which we can target. Thanks.
So Anjali, you want to say something?
Yes, Vidya.
Yeah, Anjali.
Am I audible?
Yeah.
Yeah, what I wanted to tell women surgeons, yes, you can look after your family also. I know it's very tough, very uphill task, but please try and squeeze the time for your family. Why I'm telling you, after 10 years, the whole family will be in auto mode. They don't need you anymore. And number two, at 60, you can quietly slide into them and they take care of you. So this is equally important. So it's not only the men in the workplace, the men also in your family need to do it for you. And then, of course, everything looks a little easy. But the first 10 years can be tough when the children are small.
We have Anjali Davle, also a surgeon, working in a tier 2 city, so likely to have faced more bias than Metro. So Anjali, would you like to add something to the conversation?
Yes, madam. Thank you so much. Listening to the conversation, very nice points have been brought up. But honestly speaking, gender bias is definitely there. But in addition to whatever points has been discussed, I would like to highlight that take the risk. That is one of the important aspect when you want to stand as a leadership, because whatever we have been challenged, or whatever we have been given a belt of comfortness by the family members and our partners, that is actually making us weak at some point. So you come out of your comfort zone, take the risk and go ahead. Then I think if you accept this challenge, then gender bias is basically a ribbon which you can cut through very easily, and day by day this is reducing definitely, madam.
Thank you. Actually, Kalavathi specifically wanted to highlight the uniqueness and the weaknesses. So I think one of the things, women are more risk averse than men, and so thank you very much for bringing out that point, Anjali. So I'd like to have Venkatesh Natarajan now. Venkatesh, are you ready to go?
Yes, ma'am. Thanks for asking me to be part of this. And it's been an excellent discussion overall. But what I felt is gender parity or gender equality cannot be viewed in isolation. It is part of a larger problem. And for obvious reasons, we cannot talk about these in an open way without offending one person or the other. Individual instances of excellence in terms of better outcomes or family support, these are all not I feel that these are not the key issues. So the key way to understand this overall problem, we need to think about from a larger perspective of a society where all these are derived from. And I feel strongly doctors should be advocates for this. And I completely agree with Dr. Puneet there. He pointed out how we should go about it. It doesn't start with the individual alone. And more open discussions, however uncomfortable they are, they need to be addressed too. We cannot confine ourselves to within the narrow topic of gender parity within select instances, bringing up those select instances and then trying to identify those instances as markers of a larger problem. We need to tackle the larger problem in general. And obviously, I'm skirting around that issue even without putting a finger onto it because I'm not sure whether it will be relevant to our current discussion. But I feel that we should be more open and we should be advocating for addressing society at large. What really, really bothers the society at large, what breeds this kind of a problem is what we need to address to that. And Madam Shweta Sridhar really pointed out to that. She alluded to that. And the structural problems are the ones which worries me more. And the optimistic view is that definitely the millennials or the younger generation and the generation after will be certainly better. They're reading much better, and sensitization is much better, and people understand each other much better. And women folk will certainly will progress, and their reverse bias, which we also talked about, is not also likely to be a problem in the future. Thank you very much.
Thank you, sir.
So Radhakrishna, you've been silent for very long. So would you like to come in now?
With all the
when I shared the topic, always I send him one on Sunday or Monday. I send the topic so that he can make these lovely posters. Any of you have been following Marvelous Medicine? All the posters are made by Radhakrishna, and very often he even gives them catchy titles. But this time, I think he decided the topic was catchy enough, so he didn't give it any title. But for the first time, when I sent that, he sent an emoji like, "Huh? Is that the topic?" So. I want to know.
So introduce me as the poster boy of Marvelous Medicine. See, I mean,
you are.
Yeah, the much water has flown under the bridge, and it's so interesting to see that we have come very far from what gender bias really meant. And as everybody is worried, including Murli Krishna and others, I think in due course of time, I don't know whether you and me will be doing the program together, but that will be a thing on reverse gender bias, Vidya. a time will come because things are moving in that. Is that a very progressive movement, I should say? And it's very important that we need to discuss all we discussed here in individual units, individual hospitals, and we can sort out things. When the communication things are still not broken, if that happens, I think a lot more nicety will be that workplace. On the whole, is a very well conducted, wonderful session, I should say. And I'll be definitely waiting for the day when we have a thing on reverse gender bias.
So Ilango has his hand up. Ilango, he was on standby in case we couldn't find Murli Krishna. So Murli Krishna, thank you for accepting to talk on this very complicated topic and surrounded by women.
My pleasure.
We had a WhatsApp group where we were barraging messages, and I mean, he was almost like a silent spectator. Like, so
I was
hope,
getting very insecure in that WhatsApp group. Really, I was really meant such bad people. That's what I was wondering.
I hope that's not the flavor that came out today during the session.
Yes, it was. Yes, it was a very constructive discussion. Yes.
Thank you. Over to you.
Yeah, Dr. Ilango Sethu.
Thank you, ma'am. Thank you, ma'am. It's a very interesting
We want
discussion.
to see you, Ilango, when you're sleepy, whatever.
Everyone is sleeping around me, sir.
All right.
All right. Okay. So it's a very, very nice discussion. It was very nice listening to all of you. I think social progress comes from listening and giving opportunities for diverse views. I think having women in the workforce has changed the way the world has progressed. That is very much true. I have worked with strong women. My wife is a hepatologist. So this is the need of the world. It brings change in the family as well as in the society. Interestingly, Tim Hartford wrote a beautiful book called The 50 Things That Changed the Economy, Made Modern Economy. And he wrote about two things. One is the contraceptive pill and the other is the infant formula. So that actually gave a way for the women to be a part of the workforce. So I think that was many, many decades ago. I think today we have to find out the ways to make opportunities for people to express and build their views. Like the ISRO had given opportunities for those engineers to express and really benefited after 20 or 30 years of service. And that is, I think, what we should look for. That's what we look for. I'm not a feminist, neither I support the other views, but I think having diverse opinions and views is really of importance to the progress in society. Thank you. Wonderful discussion. Thank you, ma'am.
So, Kalavathy, when you actually thought of doing this topic, do you think you have achieved what you set out to put forward to a larger gathering? And your closing comments.
Yeah. Yes, madam. We have, I think, to a large extent, if I may use the word, dissected the topic gender bias at workplace particularly. All the same, I'm glad we looked at the roots also, and how Dr. Ilango Sethu was also addressing. It's an ongoing thing, and we need to look at the roots. Like, where did I pick up my bias, and how has the home atmosphere where I grew up, and how did the society reinforce that bias? And Dr. Patta also was telling that we need to speak about it more in our units, in small gatherings. That's where actually the real power lies, and that is the area of influence also. And introspection will help. And in this group, thankfully, all men also have been very open and not going on the defensive, and more what we say. It has been on a very positive mode. In case we identify any bias, if we honestly assess ourselves, also we'll be able to see that there has been if we find that there has been a bias, and whether we are willing to be open to reconsider it and allow ourselves to unlearn certain things. I think a lot of it lies there also. And I think when we set out to bring it out and to draw focus on this matter, I think that this forum has achieved this in this evening. So I think I would like to close with that. Anybody else would like to?
One or two points each of you, and then we are ready. We are already over short time. I'm sure everybody's hungry. So, Satya, what are you saying? Oh, you're clapping. Okay. So, Kadambari, Harapriya, and Pratima, one line, and then we'll be off.
Yeah, I think we have achieved what we set out with, definitely. And the discussion has been very constructive, I should say, from the male colleagues as well. And it is certainly true that we have come a long way. I mean, if you look at it, the majority opinion was that there is no bias, at the end of it. I mean, many of us agree that we have come a long way from the actual bias where it started. So I think it's all only progressive and positive. So, but definitely it makes sense to talk about it. It makes it the awareness more, and for us to overcome it better as well.
Yeah. So, discussion definitely did not have gender bias.
Yeah, Dr.
Yes, this discussion did not have any gender bias. So it was really what we started thinking about, and I was a little concerned about talking this in a big platform like this. But slowly, as we went through the discussion, I became more comfortable, and I could share a lot of views. Thank you. And the formula is always being persistent, just proving the ability is what we need to go ahead with. And I think a lot of we need to encourage the future generation also to be very strong and not to be very what the negative aspect of females is always like being very sensitive and withdrawing themselves and running away from whatever rough patches we go through. So I think already people, particularly ladies, have accomplished a lot. And I could see, and I got more inspired by being this platform than I don't know how much I have inspired people. So thank you, everybody. Thank you, Vidya madam, and all the other panelists. And thank you, Dr. Kalavathy.
Thank you, Pratima. One point which was very encouraging was Dr. Murli brought out the losses if we are going to have the gender bias, and it was running into trillions of dollars. So that is a loss which is going to be there if we cling on to bias and not give equal space to both the genders, because each one has got strengths and each one has got limitations, and we are going to complement each other. So that's how it's going to work out. Yeah. So Dr. Murli and Dr. Kadambari, any closing remarks?
Yeah, just two things I wanted to say, that I completely agree that talking about individual accomplishments or the way we have broken the glass ceiling, or so to speak, is not enough. There is a major bulk of the problem which is still going on there, and we are not even talking about intersecting issues other than gender. So that's a different thing, but somewhere we have to start the conversation. And the second thing is, we are absolutely not looking at women being called the dominant gender or the stronger gender or whatever it is. We are looking at a situation where we are not discriminated against, and it is not our intention to reverse the discrimination and put that kind of a situation on the men. So I think the men have to get that message very clearly, that it's not our intention to turn the whole thing back on them, and do a reverse bias or reverse discrimination. Thank you.
It's never your intention, ma'am, but maybe it will happen eventually. But I would like to thank you all for this opportunity. I mean, if you had asked me 4 days ago what gender bias, I wouldn't have known a word about it. So being a panelist, I read so much and got into so much statistics, and I could really understand what women have gone through over the years and what you guys have actually achieved right now in medicine itself. So it's been a long journey, but I think it's all looking rosy from here on. All the best to all that.
As soon as the poster was shared, one of the senior woman anesthetists said, "Gender bias in the poster. Why is there only one guy?" So you were more than equal to everyone else, and you had enough support from the audience as well. So thank you so much for not being intimidated by the topic or taking it personally, or contributing so well to the discussion.
Thank you. Thank you, ma'am. Thank you for the opportunity.
Over to Dr. Vidya to
so thank you, everyone. It's a long time since we have overshot 10 o'clock. It used to be only in COVID days when we started 8 and then it would go on till 10. So it shows there are so many people logged in. Same like for sexual harassment as well. We just assume that people are not interested in talking about it, or not interested in hearing about it, or thinking of solutions. It's very obvious that the fraternity as a whole recognizes these problems and is quite eager to come forward and talk about it. So we at Marvelous Medicine are extremely happy to be able to provide a platform where we can discuss all these things quite easily in a very comfortable and very, for want of a better word, safe atmosphere. So thank you everyone for such an interactive session, and we'll meet again next week with another episode of Marvelous Medicine. Which is going to be about teaching outside teaching institutions. Like traditionally 20-30 years back, most of the teaching happened in medical colleges, but now actually it's happening outside medical colleges, and especially in the private setups and smaller places. So the patron of learning general surgery, Dr. Girijadhar Sharma, will be talking on that, and I'm sure we'll have other experts also joining in. So we'll meet again next week with another episode of Marvelous Medicine. Till then, take care and stay safe. Good night.